Today, we will be hearing from federal leaders on the TOPxHHS Tech Sprint, going into depth on the various challenge areas, the TOPx Sprint model, the prize structure, how to enter, and then we will be concluding with a Q&A. First, we are going to hear a quick announcement from Secretary Kennedy on this initiative.
What is not? Third, we're launching the TOPx HHS Tech Sprint for AI and invisible illness, including a $1 million grand prize. This initiative will harness artificial intelligence and open data to help patients with Lyme disease and other invisible illnesses get answers faster and connect to care sooner. We want patients diagnosed earlier, treated faster, and connected to care that improves their lives. Today, I'm also announcing a new public-private collaboration with the International Lyme and
So with that, Secretary Kennedy has announced the TOPx program, and we will begin with a welcome message from Dr. Kristen Honey. Please take it away.
Thank you very much, Oliver, and thank you everyone for joining here today. I'm Dr. Kristen Honey, the former HHS Chief Data Officer, and I'm now leaning full-time into public-private partnerships, open innovation, and challenge models like TOPx to bring all sectors and new solvers into urgent health priorities. We are thrilled that the TOPx HHS Tech Sprint for AI and invisible illness is now open for submissions with up to $2 million in cash prizes for winning submissions, and you're here today to learn about it. There are 3 tracks in this challenge. The first is Lyme innovation. We also have invisible illness, very broadly defined. And then thirdly, the cost of illness, the full burden of disease. We are focused on moving the needle on diagnostics, better treatments, and better outcomes for patients by unleashing the full power of government open data, open science, open innovation, and cash prizes totaling up to $2 million. The work is rooted in the belief that solutions can come from anywhere. They may come from patients and caregivers. They may come from technologists, entrepreneurs, clinicians, researchers, data scientists, students, industry, academia, or fields that have not traditionally been a part of Lyme disease, perhaps from space, perhaps from material science. And it's not just Lyme disease. We're also looking at all tick-borne diseases like the alpha-gal syndrome that transmits a red meat allergy, long COVID, ME/CFS, autoimmune conditions, mental health, addiction, suicide prevention, or any invisible illnesses. You are all welcome here. If a condition is not readily visible, it may be considered an invisible illness, and all are welcome to join TOPx HHS Tech Sprint for AI and invisible illness. Many invisible illnesses have demanded better diagnostics, better treatments, and stronger government priority. We at HHS and NIH and the LymeX Public-Private Partnership and also the Federal CDO Council, who are all co-sponsoring this TOPx Sprint, we are listening to you and we are part of answering that call. So if you have an invisible illness story to share, lived experience to bring, data to contribute, a technology to test, or any idea that is fueled by open data and AI, we encourage you to become a part of the solution and join TOPx. You can learn more on hhs.gov/Lyme and hhs.gov/Long COVID and our open data site, healthdata.gov. Thank you all. We're glad you're here, and we really hope that you will join us and submit the final submissions for this phase that are due on June 30th. Thank you.
Thank you so much. Now we will hear from Cindy Kaufman of the NIH.
Thank you. I'm Cindy Kaufman with the Office of Research on Women's Health, which serves as a focal point for health research at the National Institutes of Health. ORWH works across NIH and beyond to advance our understanding of biological, social, and life stage factors that shape women's health across the life course. ORWH is committed to growing the women's health research workforce to advance women's health innovation and ensuring that critical sex differences in health and disease are uncovered. We're excited to support this TOPx HHS Tech Sprint for AI and invisible illness. It aligns with ORWH's role in strengthening the future of women's health research by advancing innovative methodologies and accelerating the translation of discovery into real-world solutions. Many of the conditions addressed in the tech sprint disproportionately affect women, and ORWH is dedicated to supporting these innovative solutions that address the needs and experiences of those most impacted. We're excited to support this HHS effort and look forward to working with innovators, patients, caregivers, and researchers on this challenge to improve the lives of those living with invisible illnesses.
Wonderful. Thank you so much. And lastly, we'll be hearing from Jules with the FDA.
Thank you so much for having me, and thank you for everyone joining today. My name is Joel Antoine Chubube, and I'm staff data scientist within the Office of the Chief Medical Officer at the U.S. Food and Drug Administration. I'm pleased to join today on behalf of the FDA team, and we are excited to be part of this innovation effort. FDA looks forward to working with partners across HHS, NIH, LymeX, and the broader TOPx community to help advance practical solutions for patients living with Lyme disease, other tick-borne diseases, and invisible illnesses. From FDA perspective, this work sits at the intersection of regulatory science, diagnostics, real-world data, artificial intelligence, and urgent patient need. We know there is a pressing need for better diagnostics, better evidence, better treatment options, and better pathways for translating promising innovations into tools that can help patients and clinicians. Areas where FDA may be able to contribute include regulatory science approaches, appropriate regulatory pathway for Lyme disease diagnostics, and digital health tools, evidence generation, opportunities related to drug development, and potential drug repurposing and responsible use of AI, open data, and real-world data. We also want innovators to think early about regulatory strategy, including the quality, relevance, reliability, representativeness, and intended use of data they plan to use. That matter because the goal is not only to build interesting tools, the goal is to build tools and evidence that can ultimately support better detection, faster diagnosis, improve care, coordination, and better outcomes for patients. We are happy to be here, and we look forward to working with everyone as this sprint moves forward.
Wonderful. Thank you so much to all of our federal technology leads. So today we will be getting an introduction to TOPx. Next, we will be diving into the challenge topics and the process of applying and getting involved. We will go into depth on how to enter, reviewing the timeline and key submission dates, and we will also close with a Q&A and closing remarks. I do want to call out that you can use that Q&A box throughout the session, so please feel free to drop in your questions throughout, and we will try to address as many as possible at the end of today's session. Today's session is being recorded, and the slides and recording will be shared with all attendees, as well as being posted on the challenge website after the session has concluded. So let's dive in. What is the Opportunity Project? The Opportunity Project, or TOP, and its extended model TOPx, is a federal open innovation program that turns government data into actionable public tools through collaboration with experts, designers, researchers, and communities. So this model is a design sprint-like model. It's a 12 to 14-week product development sprint focused on the nation's toughest challenges. In the past, it has addressed things like the opioid crisis, disaster relief, improving workforce capability, economic opportunity, and mission-critical service delivery, among others. TOPx has become one of the government's most effective accelerators for cross-sector innovation, engaging more than 3,300 sprint participants, crafting over 280 digital products, tackling a variety of different problem areas and domains, with collaboration from 30 plus federal agencies, leveraging 450 plus data sets and also collaborating with 25 plus universities. So you can see that this overall framework is across government and has been widely adopted to drive innovative outcomes and deliver digital products. So many notable companies have also participated in these top or TOPx sprints, including Google, Palantir, Amazon, Visa, among others. Within the context of HHS, HHS has leveraged TOP and TOPx like sprints from starting in 2018 with the Top Health Sprint with support from the Presidential Innovation Fellows to pilot this first methodology to tackle health challenges. From there, TOP was used during COVID-19. The COVID-19 sprint, where teams helped create new open data and used existing open data and data standards to craft new digital tools to address that crisis. Next, in 2023, TOPx collaborated with the FDA to run a sprint focused on diagnostic data exchange, and this culminated in the Top FDA Diagnostic Data Solution Showcase. So again, there's a long history of HHS successfully leveraging the TOPx framework to accelerate solutions, accelerate R&D, and tackle some of the thorniest problems that US society faces. So just to ground this in what success looks like for all of the attendees here and really what, some examples to cite, where are we going with this TOPx program? So for example, in 2016, Esri identified an overdose hotspots and enabled targeted public health interventions using integrated geospatial data, crafting the Esri opioid analysis tool. In 2018, a tick tracker app was developed to reduce tick exposure by enabling real-time reporting and mapping of tick activity. And then in 2023, the Shape app was created to improve community health insights by integrating at-home testing and SDOH data with clinical and federal data sets. So again, this is just giving you a flavor of the types of products and solutions that are developed by going through the TOPx framework. So just to ground us in the work and really the kind of key rules or principles of this program. So first, it starts with open data. All of these solutions must be built and leverage federal open data sets as a strategic asset to inform solutions and decision making. It's also important to call out that we are interested in advancing interoperability standards such as HL7 FHIR or Fast Healthcare Interoperability Resources, as well as Medicare's interoperability standards and Blue Button 2.0, among others. So leveraging open data, leveraging the healthcare interoperability standards that have been rolled out across ONC, CMS are all very important aspects to designing viable solutions via the TOPx framework. So open data is the foundation of these solutions. Next, we want to ensure that solutions are user-centered. So starting with real user needs, designing solutions that improve their experience and outcomes is also foundational to the work done via a TOPx. So you'll notice both the data and the user-centered outcomes as absolutely crucial to building viable solutions. So this kind of culminates in ensuring that all solutions are actionable and create tangible tools or products through iteration that can be used in the real world. We want these solutions to get into the hands of users so that we can add value to their lived experiences. So your challenge, your data, the technologists and communities that you will engage with throughout the process, these will create the digital products that can solve real world problems. So we are so excited to move forward and really try to tackle some of these thorny issues. It's also important to call out that this is one of the best models to really expand the solution space and collaborate across many sectors. So this can involve collaborations with academia and research, of course, public health and the communities that they serve, health technologists, which some of you on the call might be already. And of course, we need to ground the work within patients and caregivers, engaging healthcare institutions, of course, care providers, and making sure that HHS silos are working together. And we're breaking down those silos across federal government, which, as you can tell from the participation from FDA, NIH, HHS, ONC, are all here. So that is just a wonderful thing to see HHS breaking down the silos, all working together under one shared common initiative. So it is important to appreciate we are really excited about expanding the solution space and ensuring that all sectors can come together to collaborate and really develop the best solutions because of that framework. So now that you have some sense of what the TOP and TOPx frameworks are all about, let's dive into the actual challenge topics. So like all good challenges, we want to ground this with the problem statement. And here we kind of present the crux of the issue. So tens of millions of Americans live with Lyme disease, long COVID, autoimmune diseases, and other complex chronic conditions, many of which disproportionately affect women, but do impact us all. So the result here is delayed diagnosis, fragmented care, and invisible human and economic costs. These conditions are difficult to measure, poorly understood, and too often are dismissed. So this is really kind of the heart of the issue that we are tackling with this program. So our key how might we statement, our challenge statement is no one should suffer years without answers. So how might we use open data, US open data, and AI to turn fragmented signals into trusted insights? So people living with Lyme disease, long COVID, and other complex chronic conditions are believed earlier, diagnosed faster, and supported with care that works. So you might ask, who are the Sprint target end users of this program? So as I mentioned, as we are expanding the solution space with various different end users and collaborators, we are looking to engage patients and caregivers, clinicians and providers, researchers and academics, data scientists, artificial intelligence enthusiasts, and of course, technology innovators who can put everything together. With that, this is a very important slide to understand, and really it shows the key structure of the challenge. So this is a two-phase challenge. Right now, we are in phase one, team mobilization. We are inviting teams to submit high-impact ideas so that those ideas and concepts with the strongest merit will be selected to advance into the actual TOPx sprint phase. So up to 15 teams per challenge area. So again, there's 3 challenge areas and up to 15 per may advance to phase 2, and then up to 5 alternate teams per challenge for up to 15 alternates across the challenge. So again, just to say as clearly as possible, right now we are inviting teams to submit high impact ideas, and a subset of those teams will be selected for phase 2, the actual TOPx sprint. So once the teams have been selected, we will move into the sprint portion. So that is where we will be transforming concepts into functional minimum viable products, or MVPs. And throughout that iterative cycle of R&D, you will go through the product design cycle, capturing feedback, working with US open data sets, perhaps implementing interoperability standards such as HL7 Fire. And then at the end, you will be presenting those MVPs to compete for the prize awards. So, what are the prize awards? Well, what is there to be won? So, there are no prizes in phase one. Phase one is really just getting to the team selection category. So, once your team has been selected, then you will be competing in phase two. And at the end of phase two, that is when the cash prizes will be distributed at the end in a culminating final demonstration or product demo. So there's a $1 million grand prize for the overall best solution. So that $1 million will be rewarded to any of the teams who make it to phase 2 who are able to show us that they have the strongest overall solution across all of the challenge focus areas. Next, there will be 3 first place prizes. So that's $200,000 each, one per the challenge area. There will be 3 second place prizes, $50,000 each, 15 impact awards, $15,000 each, 5 People's Choice Awards at $5,000, and there also may be some additional recognition that HHS, at its sole discretion, can provide non-monetary recognition like honorable mentions or similar acknowledgments. Finally, it is important to call out that this prize challenge is being implemented under the authority of the America Competes Act and the official rules. So this is the legal authoritative framework that we are using to implement the challenge. So let's review the overall sprint timeline just at a high level. We'll come back to this at the end of the session, but right now we are in the submission open period. So the submission period will close on June 30th at midnight Eastern, 11:59. So again, that is a very important date for you and your teams. You must register and submit your concepts before that date. And if you fail to submit before that date, then you will not be considered for the phase 2 TOPx sprint portion of the challenge. So we intend to notify teams and select the teams in July 10th, approximately. And then really the sprint phase kickoff will begin, and the actual TOPx framework, you will run through that at that point. So we tentatively will be closing the challenge on 10/15 at again 11:59, and sprint phase winners will be announced 10/20 later this year. These dates are subject to change, but it is important to just kind of frame you where we're at right now in terms of the timeline and the very important submission due dates. I'll hit on this again because it is just so important that you understand what the due dates are. So let's dive into the actual challenge focus areas. First, Lyme innovation, where we have our kind of grounding how might we question that frames the work. So how might we use US open data and AI to detect earlier, diagnose faster, and coordinate care to improve outcomes? So that is the core problem statement for our Lyme innovation focus area. Next, the next focus area is invisible illness. The how might we question for this is how might we use US open data and AI to make invisible illness visible and drive faster diagnosis, better care, and real world impact. Finally, the cost of illness. How might we use open data and AI to quantify the full impacts and generate insights that make costs visible, measurable, and impossible to ignore? So across each one of these challenge focus areas, one of the key goals here is to demystify government by helping people navigate access to US open data. There is an incredibly rich amount of data that the US government provides open source and can be built on. And really, we are hoping that across these 3 challenge focus areas, that those US open data sets and US open data resources are leveraged by all of you. So now we're going to listen to each of the federal leads go into more depth about each of the challenge focus areas so you can learn from, their technical expertise. So to begin, I will pass it back over to Jules. Jules, take it away.
Thank you so much, Oliver. From the FDA perspective, the Lyme innovation track is especially important because delayed diagnosis and fragmented care remain major challenges for patients, caregivers, and clinicians. I have to remind that in July 2025, the FDA issued final guidance. Early Lyme disease as manifested by erythema migrans, developing drugs for treatment, providing developers with a clear science-based framework for clinical trials so new therapies can move faster and with greater precision. The central question for this track is how might we use US open data and AI to detect Lyme disease and other tick-borne conditions earlier, diagnose faster, coordinate care, and improve outcomes. That includes Lyme disease, alpha-gal syndrome, and other tick-borne conditions where patients may experience uncertainty, delay answer, and fragmented information across systems. For patients, this is not an abstract question. Delayed diagnosis can mean missed opportunities for treatment, years of uncertainty, and significant human and economic burden. From a regulatory science perspective, one of the key opportunities is to turn fragmented data into evidence that can support better tools, better diagnostics, better treatment development, and better decision-making. Across FDA, there is an active focus on real-world data, real-world evidence, open data, and emerging technologies that can support medical product development and regulatory pathways. In Lyme disease and tick-borne disease, there are many potential valuable data sources, including clinical research data set, diagnostic data, medical device information, laboratory data, patient report information, geospatial data, and other real-world sources. Too often, these data are sitting in different systems. They may not be standardized, connected, or organized in a way that makes them easy to analyze. Open data and AI give us an opportunity to connect some of those signals and identify patterns that may help with early recognition, diagnostic development, care coordination, and future treatment innovation. For innovators, the question is not only what can we build, it is also what evidence will be needed for this tool, diagnostic, algorithm, or intervention to be trusted and useful in the real world. That means thinking early about data quality, representativeness, reliability, bias, transparency, validation, privacy, security, interoperability, and the intended context of use. The sprint gives innovators an opportunity to explore how open data, AI, and real-world evidence can help overcome some of the current challenges in Lyme diagnostics and care. Some potential solutions that could emerge from these challenges are AI-enabled tools that identify patterns associated with earlier Lyme disease, alpha-gal syndrome, or other tick-borne associated condition. Clinical decision support tools that help clinicians recognize when additional evaluation, testing, referral, or follow-up may be appropriate. Patient navigation or referral tools that help reduce delays and improve care coordination. Data integration tools that bring together public health, clinical, diagnostic device, laboratory, geospatial, and patient-reported data in a transparent and usable way. Dashboards or visual analytics that make diagnostics gaps, testing patterns, surveillance trends, and patient needs easier to understand and act upon. Regulatory science tools that help innovators identify evidence gaps, data quality needs, data provenance, model performance considerations, and potential pathways for review. FDA is interested in approaches that make existing data more usable, more reliable, and more actionable for sponsors, researchers, clinicians, patients, and decision makers. We also recognize that policy and practice may need to keep evolving as technology evolves, especially around data access, data quality, real-world evidence, AI-enabled tools, and reliability and relevance of existing data. As always, the specific regulatory pathway and evidentiary expectations depend on the product type, intended use, risk, and data supporting the submission. We look forward to seeing an idea that help overcome current challenges in Lyme diagnostics and treatment innovation while keeping patient safety, data integrity, and evidence quality at the center. This is where collaboration matters. FDA cannot solve this alone. HHS, NIH, patients, clinicians, researchers, data scientists, technology developers, and innovators are all have a role to play. Together, we can help turn open data into actionable evidence, improve pathways for innovation, and move toward early diagnosis, better treatment, and better outcome for patients. Thank you.
Wonderful. Thank you so much. And next, we will hear from the NIH on invisible illness.
In women's health, one of the biggest challenges we face is the enormous burden of invisible illnesses, conditions that profoundly affect daily life but lack clear outward signs or validated biomarkers. These are often chronic, complex diseases like autoimmune diseases, fibromyalgia, migraine disorders, Lyme disease, and many more. Often, women disproportionately experience invisible illnesses. Many female-specific conditions are themselves commonly invisible. Endometriosis, for example, affects millions of women and yet cannot be diagnosed without a surgical procedure. Chronic pelvic pain and hormonal or immune-linked disorders overwhelmingly affect women, yet remain misunderstood or misdiagnosed. Across these illnesses, we see long diagnostic delays, fragmented care, and symptoms that are minimized or dismissed. And this invisibility takes a toll on mental health, on trust in the healthcare system, and on overall quality of life. These illnesses are often common and very costly. This TOPx HHS Tech Sprint creates a national platform to use data and AI to make invisible illnesses visible by accelerating diagnosis, identifying treatments, and ultimately enhancing quality of life. Often, the critical data needed is hiding in plain sight. Through increased interrogation of sex differences between men and women, we hope to better understand why many invisible illnesses disproportionately impact women. Some potential solutions that could emerge from this challenge are an AI-enabled tools that improve recognition of visible illnesses and complex conditions, digital tools that strengthen care coordination and patient navigation, data visualizations that make human burden and lived experience of invisible illnesses more visible and actionable, and solutions that reduce data silos and support digital first services built for real people. One specific example is an AI model using open data sets, such as data from the Medicare claims, the CDC, and NIH clinical studies to identify clusters of symptoms commonly seen in early autoimmune diseases. We encourage you to identify ways you can contribute and participate, and we look forward to seeing your creative ideas and submissions to make invisible illnesses visible.
Thank you so much. And now we will be hearing from Dr. Kristen Honey on the cost of illness.
Thanks so much, Oliver. Hopefully my video is working. The third and final of the tracks is what basically asks, what is the true cost of invisible illness? For millions of Americans living with Lyme disease, long COVID, autoimmune diseases, endometriosis, other complex chronic conditions, the burden extends far beyond what shows up in a medical bill. There are primary costs in the medical bill and out-of-pocket medical expenses that are in claims data. However, what about the time lost taking time off of work when you're sick, or traveling to and from appointments and the cost of transportation, all these secondary costs? Also, the burden of caregivers and loved ones, because we know these complex chronic diseases, that many of them affect every single system of the human body. It's not just an individual disease, it affects the entire family, the entire community and family network. And so those costs where caregivers and loved ones take time off of their jobs and missing work and traveling back and forth. What is the full cost of traveling to different states? Many diseases have the full burden of disease, often the invisible ones, especially where there are not definitive diagnostics, and some of these diagnostics remain a clinical diagnosis. They're not fully measured in the primary, secondary, and tertiary costs. And when I say tertiary costs, I'm thinking about the emotional costs of how do you quantify through a mix of quantitative and qualitative methods, the intangibles, the suffering, the loss, and the quality of life. There are many, many methods and fields in health economics who look at that. And let's apply all that rigor from quantitative and qualitative interdisciplinary sciences to invisible illness to better understand the full magnitude of the burden of disease and the full cost to the US economy that we know is draining our US economy by billions of dollars. Too often, these costs remain invisible. And in that invisibility, patients and families face delayed diagnosis, fragmented care, reduced workforce participation, disability, caregiver responsibilities that are unpaid, out-of-pocket expenses not reimbursed, and other costs that can be difficult but not impossible to measure and quantify. So that is why TOPx includes a dedicated cost of illness challenge. We want to put a spotlight on this and really want innovators, data scientists, AI experts, health economists, technologists, entrepreneurs, people who think differently from all sectors to help us make these burdens more visible, measurable, and actionable. So the challenge question, how might we use US open data and AI to quantify the full impact of invisible illness and generate insights that make costs visible, measurable, and impossible to ignore. Participants will use federal open data from data.gov and health.gov and other sources. We have the entire federal CDO community working with us. So if we at HHS do not have the data or aren't managing that, we can turn to Department of Labor or to education or to wherever the data sets and data assets may lie and help you navigate to the right data stewards and get your questions answered about these data sets. So we can quantify the economic impact of cost to illness. So potential approaches, how you transform data and use AI to create insights and real world tools. Some outcomes might be AI-enabled tools that quantify the economic and human burden of chronic illness. Data visualizations that make invisible costs more visible and actionable. Tools that identify patterns in delayed diagnosis, care fragmentation, and workforce impact. Solutions that connect public health, economic, workforce, and patient-centered data. This exact type of challenge where fresh perspectives can make a difference, you can make a difference. Maybe our next breakthrough comes from health economics, but maybe it comes from data science or AI or a completely different field that hasn't even thought of invisible illness before because they see the problem in a new way. There is power in that. The TOPxHHS Tech Sprint for AI and Invisible Illness is a national call to action to rally everyone. And we hope that you will share your idea through the formal TOPx submission. But even if you don't want to do a full submission, you can still share your ideas on the page, share an idea today. You don't have to wait for the deadline and others can engage with it. And together we will spark solutions. If we can better understand the full cost of illness, we can make better decisions, target resources more effectively, improve care, and ultimately help patients and families get answers sooner. We cannot solve what we do not measure. Together, let's make the invisible visible, actionable, quantified, and impossible to ignore. Thank you.
Wonderful. Thank you so much, Dr. Kristen Honey. So next, let's just dive into the overall structure of these sprints. So to begin, the teams will dive into user research via a 2-week session. After that, collecting iterative feedback, they will dive into data exploration, which is where they will be asked to leverage a US open data set or open data resource. That will go into the concept pitch phase. Then preparation for an alpha demo, again, after a round of iteration. After that product development alpha demo has occurred, we would do another iteration and prepare for a beta demo over the next 3 weeks. And then that will culminate in a September event where there will be a final MVP demo and showcase, which is where the $2 million will be awarded after that point. Again, it is important to call out all of the prizes, and there is also the ability to vote on the top solutions at the end near the MVP demo showcase part of the program. So again, just to frame, this is what the overall milestones will look like when progressing through the TOPx framework. So you might ask yourself, who are the participants? Who's all going to be collaborating in this effort? So first, we have the sprint leaders, all of the folks who you just heard from. We have the tech teams, that's you. the actual technologists and solutions that you will be building. You are the tech teams. Then we'll have user advocates. So we will provide access to patients with lived experience and others who might be able to provide you feedback. And then, of course, the data stewards. So we will be providing access and our list, our most comprehensive list of US open data resources and data sets. And as Dr. Kristen Honey mentioned, we also can support you in accessing, answering questions about these US open data sets, and really just providing the infrastructure you need to build on your solution with the US open data sets. So again, we have our sprint leaders who are the kind of the agency principals who are really driving forward and representing that kind of HHS subject matter expert perspective. We've been hearing from all of these folks today, and we are so grateful across the HHS, FDA, and NIH agencies that all of these folks are participating, really helping drive this forward. So again, thank you so much to Dr. Kristen Honey, Jules, and Cindy. All right, so let's dive into the actual tech teams. Again, your job is to build products that translate open data into valuable tools. So it is important to call out that you own the intellectual property created during these challenges. We will ask if you are selected for phase 2 that you join all milestone calls and commit to finishing the product by the end of the sprint. So this is a time commitment. It depends on depending on the scope of the project, you are going to be working hard. But there is millions of dollars to be won. So that's a great, incentive. But if you are selected, we anticipate and expect, strong participation, joining calls, and really leaning in to this awesome experience and this awesome opportunity. So again, the tech teams, you are going to be owning and maintaining your solution. And your team will be ideally built by lots of different feedback, expertise, the actual data that you're serving. So everyone will be building slightly different products with slightly different use cases, addressing slightly different problems. But these products are owned and maintained by the teams who built them, and you will be maintaining your intellectual property. User advocates will be joining calls and working sessions and or you know ask me anything type of sessions where they'll be able to provide feedback. This is really helpful to making sure that you are developing something that's realistic and useful to the end market. Next, again, as I mentioned, the data stewards who will be supporting you in accessing these US open data sources and also helping provide feedback on kind of the components or composition of the data sets, as well as making sure, if possible, to drive interoperability. As I mentioned, HL7 FHIR and CMS's interoperability standards, Blue Button 2.0, are all really important. So I do encourage you to learn more if your solutions can. Those are also very powerful interoperability standards to be thinking about and applying into your solution. So we do want to call out, this is a very common question. What's the difference between prize challenges and grants? So again, this prize money is for rewarding innovation and solutions that you've already developed. So if you were to win, there will be no commitments on how to use that money. Unlike grants, where grants you might receive something in the kind of form of financial assistance and then use that money, this is rewarding you for solutions that you've already provided and demonstrate kind of via a merit-based approach that you deserve that money. And of course, the sustainability and scalability of your solution is an element of the evaluation criteria. But just to call out, this is not a grant. This is a prize challenge. We are rewarding innovation and not financial assistance. Again, here are the main prizes. So next we'll be hearing from Dr. Stephanie Herodopoulos, who will be giving a short overview of the invisible illness accountable results data over dogma.
We are going to be making invisible diseases visible at HHS. We're moving from awareness to measurable action and from fragmented insight to structured evidence, from invisible illness to accountable results, data over dogma. I like that saying, and results over rhetoric. We are going to
Wonderful. So again, we're really just driving home the ethos of this program. This is so important to understand this data over dogma, principle message, and we really greatly appreciate Dr. Herodopoulos' support of this important program. All right, let's get into next steps, how to enter, and really kind of what action you can start taking today. So there are a variety of ways to engage and get started. We want to make it as easy as possible to collaborate and get involved. So first, creating a profile and also completing a registration form is a very good first step. But you can create a profile and immediately start creating an idea and submitting an idea. So if you go to invisibleillness.crowdicity.com, the first thing that you will be prompted to do is to register. So at the top of that navigation bar, there will be a button that says register. You'll then create your profile. After you've created your profile, you can do a few things. First, you can just submit an idea. This is not your official TOPx answer, but it's a great way to get started. It's a great way to concept your thinking and then submit an idea, and that idea will be able to be viewed by everyone else. So there might be opportunities to collaborate, to refine, and to vote. So you would also be able to vote for ideas that you think are powerful or impactful. So creating a profile, creating an idea, submitting an idea, these are all great things to get started. Next, we will ask you to complete the HHS registration form, which is separate from creating the profile. After you've completed that registration form, which I'll go into depth in the next slide, at that point, you will be able to submit into one of these three challenge areas. So again, once you go to invisibleillness.crowdicity.com, you'll log in, then you'll navigate to a Participate Plus button. Once you open that, there will be a pop-up modal, and you'll be able to select either submitting an idea or submitting into one of these three categories, challenge areas. You must submit into one of the challenge areas to officially submit into the challenge. So again, just to reiterate, go to invisibleillness.crowdicity.com, create a profile. This is, a process that'll take 2 or 3 minutes, very straightforward, and that creates your account on the website. Next, we will ask that you complete this registration form. The link's right there, and it's also in the submission form itself, so you can find it pretty easily once you go to the website. This is crucial that you complete that registration form because this legally enables us to verify your eligibility and also to submit to get prizes. Finally, we ask that you submit your idea. You will go to the participate button, select the challenge area, and then you'll go through your team details and idea concept to submit into phase 1. And again, the selected teams will advance to phase 2. So what are we looking for in the phase 1 submission requirements? We'll ask for your team name, a team description. You'll have already selected your challenge area when you open the idea pop-up modal. Next, we really are interested in having a definition of the problem. So help us understand what issue you're tackling. Define a specific user need, a pain point, or data gap, and identify who's affected and why it matters. Finally, we ask that you submit the proposed concept. What does the MVP solution look like? So describe the tool you'll build, how it works, how will you use data, technology, AI, interoperability standards, and/or evidence-driven approaches to deliver a functional minimum viable product. So we ask that you explain how the proposed solution demonstrates potential for results for the American people, tech and evidence-driven innovation, execution efficiency, and delivery. And then we are looking for your overall thoughts on the scalability, reuse, and societal impact. Again, after going through this process, we will select those teams, and then those teams in phase 2 will go through the actual TOPx R&D development cycle. So, a very important question to ask yourself, how will we be evaluated? So there will be a panel of external judges as well as internal federal employees who will be supporting the evaluation panel process. In phase 1, they'll be asking themselves to judge the potential. The overall mindset will be, can this team plausibly build a useful MVP? The actual scoring that they'll be using is a 20-point scorecard across 4 criteria, and each of these criteria has a maximum of 5 points. So first, the results for the American people. Does the concept address a real user need, a patient pain point, care gap, or data gap? Next, they'll be asking themselves a data tech and an evidence-driven innovation question. Is there a credible plan to use US open data, AI tech standards, and evidence? So we need to see that credible plan to use those US open data resources, technologies, standards, etc. Next, execution, efficiency, and delivery. Is there a realistic path to a functional minimum viable product with near-term real-world utility? And then finally, scalability, reuse, and societal impact. Could the idea adapt across conditions, populations, agencies, or policy contexts? So based on the answers of each one of those, you will be evaluated, there will be a rank order list, and then the team selections will be made. Similarly, in phase two, we'll use a similar criteria, but now the judges will be looking to judge the proof. Did the team actually deliver something functional and useful? And again, here is where all of the prize money would be awarded at the end using very similar questions and framing of the criteria. So it is incredibly important that you go to nih.gov/challenges where you will be able to find the full TOPx rules and requirements. Please go there as soon as you can to thoroughly read all of the rules. This is a requirement, but I am going to call out some of the big takeaways. So again, this is an America Competes challenge. This means that this challenge is reserved for US citizens or permanent residents or businesses with a primary place of business in the United States. You shall not be a federal entity or federal employee acting within the scope of your employment. And there's a variety of other rules, but please just go ahead and read those. And then another important call out is that you retain ownership of your intellectual property created throughout this. There is an paid up royalty-free, non-exclusive worldwide license to reproduce, publish, post, link to, share, and display publicly the submission on the web, which is basically a way of saying that by submitting this, HHS is able to share your overall submission, such things like your submission title or submission description. But again, intellectual property is owned by the participants themselves. So finally, we are coming to the conclusion of today's webinar. I just want to reiterate the sprint timeline. June 30th, 11:59 is the current submission period close date, so please keep that date in mind. You must submit your phase one entry by that time period, and we are so excited to see all of the various solutions and concepts and teams that submit into this. So with that, I do also want to share that there is a list of key links and resources. We will be sharing out these slides as well as the recording afterwards, so you'll be able to access this. But again, I highly recommend visiting the nih.gov/challenges page so you can read more about the actual rules of the challenge. And then please go to Invisible Illness, create your profile, share an idea, and then get ready to submit your actual submission. So with that, we will jump over to the Q&A. I do see some Q&A items that have been coming through, so thank you so much for your interest in this. I am going to go ahead and start answering these live, and then I will pass it over to one of our federal colleagues if they're in a better position to answer the question, if it's, technical in nature. So we'll begin. I hope that we get access to the slides and recordings. Yes, of course. Give us 1 or 2 days to process. We will be posting a video and also the slides so that everyone can access them. How do we learn what teams are interested and find a team to potentially join? Great question. So I encourage you to register and also to submit an idea. You can see others who've submitted ideas. And then one thing that we could implement is we could also add a profile kind of search bar so that you could search for other folks who have created profiles. That's not currently implemented, but that is something we could do, especially if there's a need. We could implement that pretty quickly. So I think that's a good idea. We'll mark that down as something to implement in the next 1 or 2 days. So that's a good call up. But again, I recommend creating a profile, taking a look at share your idea, and then we will be rolling out a feature to search for other profiles. Okay, next question. Would it be viewed positively or negatively if there was an MVP that was already working? So, great question. Something that we've heard before. I think it's important to call out that if you define the problem and the solution, and let's say you have an existing MVP, tell us how you will use the TOPx Sprint to advance that product. It's certainly not going to be, I think, negative, but we want to understand how specifically you will be using this TOPx Sprint framework to advance your product. Kristen, do you have any other comments on that?
Yeah, just want to add on that. We welcome people who already have MVPs or already have digital tools or products out there. But what if you are admitted to the full top sprint, which will be a 4 month build together, we do ask that you develop new functionality. So for example, that tick tracker app that already existed as a free app, and what they built through the 2018-2019 sprint was heat maps and augmenting it. So yes, it can be a new product. It also can be an existing one, but tightly scope and bound what the new addition and functionality will be.
Exactly. Okay, next question. Is there a penalty for submitting to more than one challenge area if our proposed solution could solve for two? So you absolutely are allowed to do that. I typically will encourage folks to go really deep into one, but there's nothing against the rules. You are perfectly welcome to submit into multiple. It's unlikely you would be selected across both, focus areas. But you're certainly welcome to, and we love, people who are ambitious and trying to solve the various challenge areas. So please, you're more than welcome to. I sometimes encourage folks to go deep into one, but that's just kind of, a suggestion. You're absolutely welcome to submit into multiple challenge areas.
And plus one to that, and one way if you have multiple ideas is that part of the registration and TOPx submission is submitting a registration form. And it will ask who's your primary point of contact. So if you have teams with multiple people, you could have multiple ideas, but have different primary people on the registration form. So they can be different teams with the same teammates, or you could have the exact same team submitting. But we strongly encourage, especially given the large prizes, to submit the highest quality you can, and that often means investing in one idea rather than multiple.
Absolutely. Does it have to use data that US government has collected? Could it be open data that is collected in other databases? So in general, you will be required to use at least one US open data set. That is, again, kind of foundational. We are trying to increase utilization of these data sources, demystify access to them. So of course you can use other open data, but to participate and run through this, leveraging a US or multiple US open data set or data resource is certainly going to be a requirement.
And also many of the open data sites have non-government data. So if you go to healthdata.gov, the home of HHS open data, many of those data sets there are from states. They're not actually collected by HHS, but they are on our sites. So we define open data very broadly. It could be data standards for interoperability. It could be any actual data sets, could be platforms, PubMed, an open science platform that could be defined as an open data set. So it's very broadly defined.
Yeah, absolutely. Okay. For invisible illness, would telehealth options with informed clinicians be acceptable examples of driving better care? Maybe this is a good question for our NIH colleague, Cindy.
Thank you. And this seems relevant to the digital tools that could strengthen care coordination and patient navigation. So we would encourage you to focus on those aspects related to that. Kristen, would you like to add anything further?
I think at this point, all suggestions are on the table. So yes, if
Yeah.
it is, telehealth and informing clinicians, absolutely. If it's using open data, if you're putting the patients and the customers, the users at the center and the core of the process and iterating with them, and if you're either developing a new tool or new functionality to an existing one or novel insights, you are welcome in the TOPx sprint.
Great. There are three questions that I'd like to answer, and then we are about the top of the hour, just going a little bit over. So I want to be respectful of everyone's time. There's three questions I think are really important to answer, and then I'll pass it back over to Kristen Honey for final remarks. So this question is, in order to be eligible for the grand prize, which you mentioned, the best solution across all categories, does the team need to submit to all three? No, absolutely not. You should be participating in one of these tracks, and you will be, there will be one team that is wins that grand prize. It could be any of the tracks. You will not be building a solution for all three. That's just not within the scope, and you wouldn't want to do that. That's going to be there's a lot of work that's going to go involved in just focusing on one solution through the TOPx track. So that addresses that. Can you edit your submission after you submit? So you can't edit your submission after you submit, but what you can do is you can create your solution and then you can save it as a draft. So that's what I recommend you to do. So you can go create your profile, open the idea participation, idea modal, and you can build your whole concept and then you can hit save as a draft. So that's what I'd recommend. Um, I don't think you would be able to edit your submission after you submit, but certainly go ahead, craft it, save it, make sure that it's polished before you submit. Okay. Finally, can you apply to other LymeX challenges not included in TOPx? Absolutely, you can. There is a variety of other initiatives, including the Visible Voices Prize, as well as a healthathon. You are absolutely allowed to participate in those, and we encourage it. This is all about opening the doors and making sure that people can participate across the board. So please go for it. With that, we are a little bit over time. I'd like to pass it over to Dr. Kristen Honey for her final remarks. But with that, I do just want to say thank you to all who are attendees. We are so appreciative of your time, and we're so excited to see the solutions and teams and advance into phase two, where we can really start building technologies and solutions. Dr. Kristen Honey,
Thank you,
take it away.
Oliver. Thank you to all our presenters and everyone who's joined us today. We will be posting the webinar on the TOPx site. So for those who weren't able to join live or see the whole thing, you will be able to see this. We can also post the slides. And for those questions in the Q&A that we did not get to answer, we will be doing some write-ups and written answers and getting those online. So they'll be available to everyone. One of the questions was, do you have to have AI and do you have to have all four of open data AI? No. We just think that in this complex, multi-systemic, chronic inflammatory conditions that affect so many systems of the human body, that we are at a unique time in science and medicine where emerging technologies like AI can really identify and answer questions and show us patterns that up till now have been invisible and really validate so much of what the lived experience of patients, frontline doctors, and those on, all of us on the front lines know these complex issues from a different vantage point. So you do not need AI. We just think that there is a whole frontier for understanding these, and that's the focus of why we're pushing on AI and invisible illness. So with that, feel free to reach out to us. The best email is either lymeinnovation@hhs.gov or the Ensemble one, and we will put all this on the website. And the solutions are going to come from you. So thank you for joining. We firmly believe the solutions are out there. And if we can put a spotlight on them, crowdsource them, and then hopefully you will be well rewarded for your contributions. And we all look forward to seeing what you create. So thank you for being a part of the Solutions with TOPx HHS Tech Sprint for AI and Invisible Illness.
Thank you, everyone. Bye now.